Yes, ma'am, we are on live, ma'am. A very warm welcome to all the budding engineers of Chennai Institute of Technology. This is Shweta from third year Biomedical Engineering. I'm quite happy to meet you all in this virtual platform. Let us begin the event with Tamil Thai Valthu.
நீராறும் கடலொடுத்த நிலமடந்து எழிலொழுகும்
I take immense pleasure in welcoming you all to Knowledge 4.0, a technical webinar series. Today's webinar is on women health. I hereby call upon our principal, Dr. Ramesh sir, to deliver the welcome address. I welcome you, sir.
Thank you. Good afternoon to all. Respected guest for today's program, Dr. Karthika, Coordinator of Vice Club of Chennai Institute of Technology, Dr. Valarmadi ma'am, other office bearers of Vice Club, and dear students. On behalf of Chennai Institute of Technology, I take immense pleasure in extending my sincere welcome to our guest for today's webinar. Welcome, ma'am.
Thank you, sir.
I also extend a warm welcome to all the participants. Dear students, at Chennai Institute of Technology, we give a lot of importance for the women empowerment. Under the name of WISE Club, Women in Science and Engineering, we regularly conduct a lot of events for the benefit of women faculty members and as well as women students. Not only that, we also conduct a lot of program for the women community located in our surrounding areas. Under Unnat Bharat Abhiyan scheme, our institution has adopted 5 nearby villages, and in all these villages, under the WISE Club, we regularly conduct a lot of events, mainly focused to empower the women community in those villages. And in our institution itself, we have given equal importance and equity to women faculty and as well as girl students. In all our administrative and academic bodies like Anti-Racking Committee, Internal Complaint and Grievances Cell, Cultural Club, and every club and committees, we have given equal representation from the women faculty and as well as from the girl students. And WISE Club is also very live and vibrant at our campus, and regularly they arrange a lot of program for the benefit of girl students. So in that line, today they are organizing an important event of creating an awareness about health by inviting a doctor from Madras Medical College. I hope this program will be highly beneficial to all of you. And I also have a strong hope that Vice Club will conduct these type of programs quite often at our campus so that the entire women community will get benefited, both those who are in our campus and as well as surrounding villages also. Once again, I extend a warm welcome to every one of you for this program. Thanks for the opportunity.
Thank you very much, sir. We are really fortunate to have you with us. I now welcome Dr. P. Valarmadi ma'am to give a gist of WISE, Women in Science and Engineering. Welcome, ma'am.
Yeah. Is it audible?
Yes, ma'am, you are audible.
Respected Principal Sir, Chief Guest of today's program, Dr.S.KARTHIKAA, Madam, dear faculty members and my dear girl students, good afternoon to all of you. WISE, Women in Science and Engineering. Already Principal has told, we have started WISE in the year 2019 to empower our girl students and women faculty members. Under WISE, we have identified 8 themes. The themes are women and health, environment, sanitation and hygiene, technology for women, self-defense, technology for women, legal awareness, literacy and life skills, women innovators, and women entrepreneurship. Every year, we are conducting several programs to empower our women community under different themes. For the past 2 years, we are conducting a lot of programs like creating awareness on women health and safety program for women community and how to develop in the technology oriented things. So we have adopted 5 villages in the nearby college. So every year we went to the village and conducting many programs. The main motto of WISE is to empower women community and creating awareness in all aspects related to the women. This year, this is the first program we are organizing. I am very happy about that. So there are a lot of programs we are planning in the upcoming months. In the first week of February, we have planning a mobile app development program for girl students under the theme of technology for women. In the fourth week of February 2022, we are planning to conduct an awareness program on practice yoga and meditation under the theme of literacy and life skills. And first week of March 2022, we are planning to conduct a seminar on awareness on women entrepreneur under the theme of women entrepreneurship. And fourth week of March 2022, we are planning to conduct a legal awareness program under the theme of legal awareness. So likewise, every month we are planning to conduct lot of events under the WISE. The main outcome of this activities are to motivate our girl students and also to participate in all the competitions and events. This is the main motto of this WISE, the gender equity. So the gender equity we are maintaining in all aspects. For whatever the competitions we are conducting in our college or outside the college, like hackathon, like any other events. So the participation on women students is mandatory. So our students also very much supportive and motivated. Really, I thank our management for providing this wonderful platform for a women community to empower us. So thank you once again for giving this opportunity. My best wishes to all of you. I hope all of you will support, all girl students support in all upcoming events. Thank you all. Thank you.
Thank you so much, ma'am. First of all, a heartfelt thanks to the doctors for the care they provide every day. We appreciate your presence at this difficult time, ma'am. I take this opportunity to introduce our today's chief guest, Dr.S.KARTHIKAA, ma'am, M.B.B.S, M.D. in General Medicine, D.M. Cardiology from Madras Medical College. She has won first prize in PHFI National Cardiac Image Quiz and second prize is Infectious Disease Prize Exam in SITSCON 2018 8th and Annual National Conference at Krishna Medical College, Vellore. First prize in the quiz at the ACS Medicon National Conference, Chennai. She has also secured second prize in the paper presentation in the ACS Medical National Conference 2018 held at ACS Medical College, Chennai, and much more. I now request Dr. S.KARTHIKAA ma'am to deliver her speech. Welcome, ma'am. Ma'am, please unmute yourself, ma'am.
Thank you. Thank you for the warm introduction. Am I audible?
Yes, ma'am, you're audible, ma'am.
So, shall I start my presentation? Yes. So, today we are going to discuss about women's health. So, women's health is not a single entity to discuss. It is actually a multidisciplinary, multifaceted entity which encompasses the physical, emotional, and the social well-being of the woman as a whole. So, as Nelson Mandela said, an educated, enlightened, and informed population is one of the surest ways of promoting the health of a democratic nation. Health, according to the World Health Organization, is a state of complete physical, mental, and social well being. We ignore the last two actually, only we focus on the physical health. So, what about the mental health of an individual? What about the social well being of an individual? We have to give equal focus on all these three parameters. It is not merely the absence of disease and infirmity. Being a man or a woman has a significant impact on health as a result of both biological and gender related differences. We don't have to go inside the topic at all because we are well aware what are the differences we face in our society as a girl or as a boy. Okay. Women bear exclusive health concerns such as breast cancer, cervical cancer, pregnancy, and menopausal issues. I'm sure many faculties are also attending this program, so I have made useful information for them also. So, as this picture clearly depicts, we can tell that women should involve in all the activities, everywhere we should come forward. But see what the hurdles we have to cross in order to forge a race with the men, actually. So, the challenges faced by a working woman are much more. More than the young girls attending this session, I think the faculty will be aware how much work they have to do at home and then come here. They have to work here also, put their 100% effort, and then go back home. There is no rest for ladies. That is the truth. So these are the challenges faced by a working woman. So to promote health in a woman, what are the areas we should focus? One is the nutrition. Second, physical activity, which is highly missing nowadays. Next is the screening for health issues. So in an age more than 40 years, it is better to screen for some prevalent diseases in the community and focusing on the mental health, most important, focusing on the reproductive health, and finally, to focus on preventing the common infections that might occur. So nutrition as a basis. What do women usually face? The most common thing is anemia. So anemia is very much common in women, mostly due to insufficient iron in their diets. We can tell insufficient diet itself. Usually the mom is the one who eats last in the family. So you can judge how much nutrition she will be getting. So like that, insufficient iron in their diets, menstrual blood loss. So the menstrual blood loss is a major contributing factor to iron deficiency anemia. And also during puberty, that is a period of rapid growth, women are prone for anemia. Usually it is asymptomatic. So probably we will be diagnosing it when we do blood test for some other indication. We will come to know that we have anemia. And usually during pregnancy also we will come to know that the hemoglobin is very much less than that of normal. So why it is important? See, in our community, more than 1/3 of girls in the teenage, that is 15 to 19 years, are anemic. So you can see how many girls are affected. So most common is iron deficiency. The anemia increases the risk of hemorrhage, that is bleeding, and infection complications during childbirth. So that is why we are very much giving importance to correction of anemia during pregnancy because it can lead to infectious complications and bleeding complications during labor. And also it reduces the productivity in adults. So we will get easily fatigued, easily tired. We cannot do so much work. We cannot run that much. We will get breathless easily. Like that, many symptoms of easy fatigability we will be getting if we have anemia. So you should be aware of that. Prompt correction of anemia is vital for healthy living. And also you must be aware of the iron-rich foods. These include soybean, oatmeal, raisins, eggs, shellfish, grain bread, red meat like chicken, and green leafy vegetables. So first we'll start from the adolescent health issue and thereby go on with an increasing age pattern. So in teenage, what are the most common things we face? Due to the hormonal imbalances and the pressure that has been put by the society to prove ourselves and what's or not. So women face hormonal imbalances like leading on to weight gain, sudden mood swings, irregular menstrual cycles, and unwanted facial hair. The other thing is this leads to onto a complexion, like they feel so much depressed because of that, and this is a vicious cycle. This adds on to the stress, and this leads on to more hormonal imbalance. So what must you suspect then? You need not become a doctor, but you must know when to consult a doctor. That is the awareness part. Okay, self treatment is not awareness, it is recognizing that we have some issue and getting early treatment, early correction for it so that we avoid late term complications. That is the um, idea of knowing all these things. So, once you have these changes, then you have to consult your physician because most commonly thyroid issues. Thyroid disorders can result in hair loss and that mood swings. Okay, and PCOD. PCOD is very much common in our society. We feel like we are the only person affected with PCOD. It's not so. If 10 girls are there, almost 4 to 5 will have PCOD. But is that much common? Thereby, if you have any of these symptoms, we can suspect PCOD and it can be asymptomatic also. Also, if you have any symptoms of easy fatigability, consult your physician for ruling out anemia. Avoid unwanted fear. Every medical issue has a solution. The only responsibility of yours is to seek help early. We are there to help you. Women often neglect their health, being afraid of societal pressures. Once if they go to doctor itself, some major health issues there like that, people start talking. It's not like that. We can give solution in the early stage itself and correct everything. So reproductive health, proper sex education, and the awareness about the risk of sexually transmitted infections can help women avoid unwanted pregnancies. And once a woman is pregnant, how to go about it? What are the things that is essential? Because maternal mortality is still one of the leading killer of women. No one is supposed to die at the age of 20 or 30. That is cruel. So in order to avoid that, what we must be knowing, all pregnant women should be booked and immunized in our society. Booked means they should be registering themselves in a primary health care or in a hospital setup recognized by the government, and they should be followed up every trimester of their pregnancy. They should be given proper tetanus toxoid immunizations. Usually, when you book yourself in a hospital, in a primary health care, we do baseline screening during pregnancy, including the glycemic status, that is the sugar level, the lipid profile, the thyroid levels, the hemoglobin level to rule out anemia. And we also check the heart health of a woman, including ECG and echo, because you won't believe it, during pregnancy only, first pregnancy, when we do a echo only, we detect so many silent heart defects in apparently asymptomatic people. We should not be afraid of that. So it is not going to affect you that much, but we must do some corrections for those defects. And blood pressure is monitored throughout pregnancy. Because of the absolute hemodynamic changes happening during pregnancy, there will be fluctuations in BP level also. Certain groups of medications are to be avoided during pregnancy. That way, we strongly recommend do not take over-the-counter medications during pregnancy. Always consult your physician before taking any drug. You can take folate supplements, iron and calcium supplements during pregnancy as suggested by your consultant physician. So after pregnancy, next is the family planning. So usually multiparity is avoided. That is, multiple pregnancy should be avoided in order to reduce the maternal mortality. So after 2 children nowadays, we are suggesting family planning. And also there should be adequate gap between 2 pregnancies. A rapid succession of pregnancies also affects the mother's health adversely. So the most effective 2 modes of family planning is contraceptive device, intrauterine contraceptive device, also known as copper T. We know that commonly as copper T. And The tubal ligation, that is tubectomy, sterilization procedure for family planning is tubectomy for women. For men we call it as vasectomy. Okay. The second most effective methods of contraception involved OC pills, oral contraceptive pills, rings and patches. Least effective are condoms and diaphragms. So you can opt for any of these birth control measures. Next major part which we must be aware is the emotional and mental health. So women are more prone for depression and anxiety. We cannot help it because that is because of the natural hormone fluctuations. 1 minute. So the natural hormone fluctuations can lead to depression or anxiety. Depression and anxiety exhibit more frequently among female patients. We all know, just before the period cycle, some women experience sudden mood swings. We call it as a premenstrual syndrome. It occurs commonly among women, while premenstrual dysmorphic disorder presents similar way, but greatly intensified symptoms of emotional lability and depression. So, next concept is postpartum depression. This is also common. Shortly after birth, many mothers acquire a form of depression called the baby blues. But perinatal depression causes similar but much stronger concerns, emotional shifts, sadness, and tiredness. This is a very, very real entity. You must opt for consultation to your family physician and get proper treatment advice for that. And when they near menopause, that is during 45 to 50 years of age, the perimenopausal period can also cause depression. I will explain about menopause later. No matter how intense the symptoms, there is care. There is available treatment. Care providers can provide relief with prescription or therapeutic treatments. So managing work stress. So we are all in such a competitive world. We need to succeed. We need to shine. Everything is okay. But always allot a me time for yourself, for self-reflection, self-motivation, and planning. Surround yourself with like-minded people, not someone who brings you down with a negative mindset. And have a moving on mindset. Nothing lasts forever, neither failure nor success. Always promote a balanced diet. Have a balanced diet. Do regular exercise. This is not a joke. We have to take care of ourselves. Around 30 minutes per day for at least 5 days a week. And the time we go through Netflix and all those videos, that time we can do these things. There's always time for our health. After the age of 40 years, regular health screening is recommended. So now we will discuss about the specific health issues. This following group of illnesses pose considerable health risk in women. The first is the heart disease, next breast cancer, ovarian and cervical cancer, gynecological health issues, pregnancy issues, autoimmune diseases, depression and anxiety, and postmenopausal issues. Heart health. So this is my specialty. Globally, cardiovascular disease, often thought to be a male problem. We think only men get heart attack. No. Women. For women, heart attack is the number one killer of women. Women suffer higher heart attack deaths compared to men. So they smoke, they drink alcohol, they get heart attack, they go home after treatment. But women have higher mortality rates when an attack occurs. The prevalence of coronary artery disease is increasing nowadays because we are mimicking men in working. Hectic work shifts, improper nutrition, long hours of physical inactivity, and inadequate sleep. Heart attack is not the only heart disease out there. Heart means not just heart attack. Other heart issues prevalent in young women include, they do not know until they become pregnant, many of these people. Rheumatic heart disease, that is valvular disease such as mitral stenosis, that we will deal with. Like the heart disease where the heart's valves are affected, leading on to improper filling of blood. So it can result in breathing difficulty in women. like they will not be able to climb stairs easily. Those will be the symptoms they will present to us. And congenital heart defects. These also first detected sometimes when the girl becomes pregnant. That is, we usually call in the layman's term, hole in the heart, an atrial septal defect or a ventricular septal defect. They may not be recognized in childhood. They will come to us in the adolescence or early adulthood. And arrhythmias, that is rhythm disturbances in the heart. Women can present, young women, especially 20 to 30 years of age, many are prone for supraventricular tachycardia. These are not, the name can be long, but the thing is they will have palpitations, the padabadap. So these palpitations can occur either due to anxiety or due to some heart problem also. So it is very much well to take an ECG and check when you have those symptoms. The palpitation can be even due to anemia. Palpitation can be due to thyroid disorder. Palpitation can be due to an underlying heart disorder. Okay. Next is breast cancer. Breast cancer is the most common cancer in women. So high risk, we should not think why we will not get breast cancer and all. How is it possible? Not like that. We should be aware who can get, how we have to assess early, because early treatment of breast cancer is treatable, not the point. We can totally have the cancer in remission and lead almost a healthy life if we detect it early. If you leave it as such, if you're shy enough, like I'm going to hide my breast lump, I'm not going to tell anyone like that. If you leave it, then it is really going to spread to other organs like bones and lungs, other tissues, and then it becomes incurable. There is nothing we can do for it, and our life expectancy will also decrease. So awareness is very, very important regarding breast cancer. Who should be more aware? More of high risk patients include those having a family history of cancer, like mother or siblings having breast cancer or ovarian cancer, any genital cancer, and elderly women more than 60 years of age. Those have never had a child. Nulliparity means no child. Or sorry, or those having a child in the late first pregnancy, that is after age 30, having a child after the age of 30 years, and those have never lactated. So these women are at risk. And those women using oral contraceptive pills for more than 4 years duration, they are also at risk for breast cancer. And smoking, which is not prevalent in our population, but in US and other countries, women do smoke. So smoking is a risk factor for breast cancer. So what are the signs and symptoms of breast cancer which we must be aware of? So one thing is we can have a lump in the breast, or there can be a depressed skin lesion, or the whole breast can be swollen. The nipple can be affected. There can be a bloody discharge from the nipple. Sometimes we will have a pain in the breast or just a skin irritation. So we must be aware of all these signs and symptoms. So how to detect? The most effective and common thing to do is self-examination. So while having a bath or while changing your dress, we have to do self-palpation of the breast. This increases the awareness in women. And if any lump is detected, you can consult your physician. And it brings her to the doctor at an early stage for treatment. So after the age of 40 years, it is better to have a breast self-examination by yourself regularly. When to do a mammogram? So even in the woman health checkup, if you check in major hospitals, a mammogram is available for all women. So who should do that? Older and high risk population, as I've explained earlier, who are at high risk. And if you think you have a lump, then you go for a mammogram. Next, after menopause, when you are planning for hormone replacement therapy, then also you have to do a mammogram. So these are the indications for doing a mammogram. 2 yearly screening between 45 to 60 years of age is cost effective in high risk cases. So every 2 years, every other 2 years, you have to do a mammogram in high risk patients. Faith over fear is very, very important. As I already told, I have seen patients, seen women coming to us with back pain, severe back pain, paralysis, and we will be wondering what neurological problem they are having. Finally, we diagnosed that the woman is having a breast cancer. So the breast cancer has spread to her bones, spread to her spine, causing paralysis, has infiltrated her nerves. So she's in the final stage. Still, she's not opening her mouth and telling that she's having a breast lump. So that is the amount of fear that our population has in gynecological issues. So you should not be afraid. If you have a breast lump, go and check. It can be normal lump also, not a cancer, not always a cancer. If it is a normal breast lump, you can just leave it as such, or if it is causing pain, you can remove it. It is as simple as that. If it is going to be a cancer problem, then effective treatment modalities are available if we go as soon as possible. If you just leave it, if you're afraid of what mom will say, what others will say like that, then it is going to be a useless cause. We can't help it. Next is cervical cancer. So cancer cervix accounts for 15% of all cancer in females. So who are at high risk for cervical cancer? As I already told, avoid multiple pregnancies. That is why our government has brought about a rule itself. So the average age of cervical cancer is 35 to 45 years. See, so young. It is not only grandmas who will be getting. It starts at a younger age. So who are at risk? Having intercourse before the age of 18 years, delivery of the first baby before age 20, and having multiple pregnancies, multiple babies with poor birth spacing between the pregnancies, having multiple sexual partners, having a poor personal hygiene, and those coming from a poor socioeconomic strata, women with sexually transmitted diseases, human papillomavirus infection, herpes simplex infection, and immunosuppressed individuals like post-renal transplant, kidney transplant, which is becoming common nowadays even in young women. So they are prone for cervical cancer. And also chronic use of OC pills. That's why always have a doctor's guidance while using contraceptive pills. Never take it like Dolo 650. Because chronic use of OC pills can double the risk of cervical cancer. More than 8 years only, not for just small duration like 1 year. So how to screen for CA cervix? There are effective screening methods available for early detection of cancer cervix. The most commonly used thing is pap smear. So our young students, young population must be aware of what is a pap smear. It is nothing but a cellular screening, that is a cytological screening of the cervical cells. This should be offered to all women, noted here, above the age of 21, for sexually active for at least 3 years. So the usefulness of pap smear is shown by the fact that, see, once some abnormal cells are detected by pap smear, it takes about 10 to 15 years for an invasive cervical cancer to develop, which is very much difficult to treat. So we have a long latent period before which we are detecting that the patient might be getting a cancer in the future. So this long latent period is the time we are going to give a superb treatment for the patient. So this long latent period allows adequate treatment of the abnormal cells, that is dysplasia, and prevention of invasive cancer. Screening programs have been adopted in developed countries. They are very much prevalent. They have proved successful in reducing the incidence of invasive cancer by 80% and mortality by 60%. So it is prudent to repeat the pap smear annually. That is, every year you have to do a pap smear for 3 consecutive years. So all 3 years the pap smear is negative means, then you can repeat it every 5 years once, up to the age of 50 years. So every 5 years once, pap smear is enough. After 50 years, the incidence of dysplasia drops down to 1%. So no need to go on checking. Always ignorance leads to fear. So we must know how they are doing a pap smear, what they are actually doing. Nothing to worry about. They will just make us lie down and place the feet in stirrups or foot rest. That is a lithotomy position we call it. And then your doctor will insert a speculum into the vagina to hold the vaginal walls open. Then they will just take it will be just a swab. We know, right? They will quickly brush a long, thin swab over the cervix to take a cell sample. That's all. This is a pap smear. They will place the cells in a petri dish and send it to a lab for testing. So it's a very simple procedure. It doesn't cause any pain and it takes only 2 minutes to do it. The next most common thing that we encounter in the reproductive age group is fibroid uterus. Fibroid uterus is nothing but a benign tumor. That is, this is not cancer. This doesn't grow uncontrollably. So cancer is nothing but an uncontrolled multiplication of cells. This is just a normal நம்ம சொல்ற மாதிரி கொழுப்பு கட்டி அந்த மாதிரி. So benign tumor seen in women of childbearing age group. This tumor occurs in the uterus. So how do they present clinically? Usually we may not know that we are having a fibroid. 50% of women are asymptomatic. When we do ultrasound for some other reason, we may detect a fibroid. Mostly they will present with menstrual disturbances, like women having menorrhagia, increased bleeding, or many cycles in 1 month, many menstrual cycles in 1 month, increased blood loss, like that during periods. They present like that. They can present with infertility. There is conception problems. They can present with repeated pregnancy loss, abortions. Fibroids can present with abdominal pain. They can present as an abdominal lump. Women can have postpartum hemorrhage, that is bleeding after delivery because of fibroid. And sometimes these fibroids can compress upon the bladder in front of them because the uterus is an organ that just lies behind the bladder. It can compress on the bladder and cause urinary retention, urinary problems. So this is how a lady presents with fibroid. So can we leave the fibroid as such? Some fibroids are very small. They remain silent. They do not cause any symptoms. You can leave them. Symptomatic fibroids or those leading on to infertility, those leading on to bleeding complications, menstrual irregularities, and some complications can occur. Pedunculated fibroid, that is a fibroid with a stalk, it can twist along itself and cause hemorrhage, infection, severe pain, abdominal pain. So both medical and surgical treatment are available for fibroid. Medical treatment mainly focused on shrinking the tumor, reducing the size. But myomectomy is a viable option. That is surgery, removal of the fibroid. Myoma. Fibroid is also known as myoma. So you just remove the fibroid. Myomectomy improved fertility in 40% of patients. So you can see how much they improve. Genital prolapse, which is more common in the elderly, more than 50 years of age. We must be aware of this. Genital organ descent often results from weakness of the pelvic connective tissues. It can be acquired following prolonged and difficult vaginal delivery and multiple pregnancies, that is rapid succession of pregnancies, such that there is no time for the pelvic floor muscle to come to its original state. Immediately the woman has become pregnant. So there's a risk factor for weakness of the pelvic floor muscle. Thereby, in this picture, you can see that's the normal position of the uterus. Here, the uterus has descended down. That is a prolapsed uterus. That is descending down. Also, conditions causing rise in intra-abdominal pressure, like a tumor, abdominal tumor, or it can be obesity also. Excess weight can lead on to prolapse, aggravate prolapse. and menopause leading on to tissue atrophy. It can weaken the pelvic floor muscles. Menopause can contribute to genital prolapse. So how do they present clinically? Usually the woman feels a sensation of something descending down the vagina, and which is aggravated by straining and coughing and heavy work. She might have urinary symptoms like increased frequency. Many times they will get up and go for the restroom, incomplete voiding sensation, and repeated urinary tract infections and urinary retention. Sometimes they will have backache also and coital problems. What can be done? We have to know that everything doesn't require surgery. Minor degrees of prolapse, and for younger women less than 40 years of age, just avoid weight gain, promote weight loss, do aggressive pelvic floor exercises. I have noted here down Kegels exercises. You can also go and search for it. So you do these exercises post delivery also. This will improve the tone of the pelvic floor muscles. It will both help in treating the milder degree of prolapse. It will also help in preventing prolapse post delivery. And for major prolapse, then age more than 40 years, we have to go for surgery with pelvic floor repair. Next is menopause. So what is menopause? It is a time of cessation of ovarian function resulting in permanent amenorrhea. Amenorrhea means cessation of menstrual cycle. The periods is stopping totally. It is a retrospective diagnosis, that is only after 12 months of the menstruation being stopped. There is no periods for 12 months. Then we confirm that menopause has set in. The usual age of menopause is 45 to 50 years. Usually the patient has, so these are the symptoms of menopause. The lady has hot flushes, improper sleep, sweating, thinning hair, brittle hair, and bone weakness. The sequelae of menopause include insomnia, that is sleeplessness, mental depression, arthritis, osteoporosis, that is a decrease in the bone mineral density. You would have heard of it. They will tell that you have to take a DEXA scan, that is to check the bone mineral density. Osteoporosis is decrease in the density of the bone that occurs in women for attaining menopause. That is because the protective effect of estrogen has gone now. So estrogen deficiency leads to osteoporosis and fracture. So they are more prone for fractures. Cardiovascular and cerebrovascular diseases also become rampant once you attain menopause, because estrogen is a hormone which protects you from heart attack, which you believe. So that is gone. You become more prone for heart attack, stroke, systemic hypertension, and genital prolapse because of tissue atrophy. Also, cataract, glaucoma, and all such eye problems come. Mental depression leading on to Alzheimer's disease, that is poor memory. Memory deficits also set in with menopause. So, proper recognition of these features and getting proper care for them. Hormone replacement therapies are available. Antidepressants can be taken with consultation with a physician. Never take over-the-counter drugs. Always consult your family physician and get appropriate treatment for all these. Menopause time is very much real, and you will have all these symptoms. We should not be afraid of them. Just be aware of them and get appropriate therapy. Autoimmune diseases. Autoimmune diseases is something which we must know, because many girls do not know this. It is common in the age group of 20 to 30 years. This is predominantly belonging to a subspecialty, that is rheumatology. So you have to consult a rheumatologist if you're having an autoimmune disease. So what is an autoimmune disease? It develops when our immune system is actually like our country's military. So our immune system, which is designed to fight off foreign cells and keep us healthy, mistakenly produce antibodies that attack its own healthy organs, cells, and tissues. More prevalent in women compared to men. women are the most frequently affected with autoimmune diseases. Few of the most common that we should be aware are SLE, that is lupus, systemic lupus erythematosus. Systemic lupus erythematosus is very common in 20 to 30 years of age group girls. It is a common problem. It is not like you are the only one affected. So many girls are affected. It is a systemic disease that affects many parts of the body. You must know that it is not contagious, it is not infectious, it is a treatable condition, and usually the cause is not known. The girl presents with unexplained low-grade fever, weight loss for almost 6 months to 1 year, and she will have hair loss, excessive hair loss, multiple joint pains. So they'll be telling what in this age you're having joint pain and no one will believe. But that is a presentation of lupus, multiple joint pains, and also a feeling of fatigability. Lupus affects many organs. The most commonly damaged organ is kidney. So lupus nephritis is a very, very dangerous entity which we must be very much aware. And it is treatable. That is one thing. Thyroid diseases. So Graves' disease is one entity that presents with hyperthyroidism, that is hyperfunctioning of the thyroid gland, and Hashimoto thyroiditis, that is also an autoimmune disease in which the cells and the antibodies attack the thyroid gland and cause a reduction in the thyroid hormone synthesis. They present with hypothyroidism. We know the features of hypothyroidism like weight gain, brittle hair, and irregular menstrual cycles. So, rheumatoid arthritis. So, rheumatoid arthritis mainly affects the joints. It can lead on to uh, severe joint deformities if not treated early. And psoriasis. Psoriatic arthritis is also common in our young women population. We know psoriasis leads to scaly skin lesions and also it affects the joints. Multiple sclerosis. This many of us might not be knowing, but multiple sclerosis is also a common autoimmune disease. It is a disease which affects the central nervous system. The nerves, the sheath covering the nerves is mainly attacked by the autoantibodies, leading on to multiple sclerosis. Patient can present with blurring of vision and also it can lead on to paralysis. So any blurring of vision, we have to be very much aware. This is a possibility. Conclusion, looking after our health today gives us a better hope for tomorrow. It's up to you all today to start making healthy choices. Not choices that are just healthy for your body, but healthy for your mind and spirit. Today, I have just given you a glimpse of the variety of diseases that can manifest in women specifically and how we must catch them at their early phase and prevent them from becoming severe. We cannot direct the wind because if disease is going to come, it's going to come. But we can adjust the sails. We can maneuver what can be done for that in an early stage. That's possible only if you are aware of what you're dealing with. It cannot be done with ignorance. So awareness is always the beginning of a positive change. Thank you.
Thank you so much, ma'am, for enlightening us and guiding us. You have made us realize the importance of taking care of our health by your graceful words, ma'am. Yes, guys, now the session is open for discussion. If you have any doubts, you can post it in the chat box. Ma'am, Vishnu Priya has posted a question in the chat box, ma'am.
My father via grandmother. Okay, yeah. So, if there is a family history of breast cancer, it doesn't necessarily mean we are going to get breast cancer. It just means that we have to be self-aware of that. As I have already told, they come under the high-risk group. Doesn't mean they are going to get it. So they should have proper checkups every few years. And there is also a genetic testing available, like BRAC gene. They do that if there is a family history, positive family history, that is available in hospitals. We can do that and we can rule out any familial possibility of breast cancer.
Thank you, ma'am. Guys, if you have any doubts, you can post it in the chat box. Ma'am, I think everyone is clear.
It is very difficult to come out with personal health issues in a
Yes,
public
ma'am.
forum. I can understand that.
Yes.
But I hope that I have just covered the common health issues that young girls will be facing, and also as the age goes on. Menopause is that's what the main thing. It is a normal phenomenon that occurs in women, but more women are affected. It is a health issue. Definitely, it's a health issue because these symptoms will be prevalent. We will be thinking it is common. But some women will be more emotionally labile. They will be having a severe form of depression. They might not know. They would have been working so long, well and good. Suddenly, they will go for depression. Why? What happened to me? That phase in the age of 45 to 50 years, everyone will come across. That time, they should be aware that it can be due to the hormonal fluctuations. It is not their mistake. It is a health issue that is resulting in all such mood swings.
Thank you, ma'am.
And you should also concentrate on your bone health at this stage of life. Around 45 to 50 years of age, women must know that they can have bone mineral density deficiency, and therefore they must be careful in taking calcium intake and all such things.
Ma'am, I think we can move on to vote of thanks, ma'am.
Okay.
I, Shweta E, on behalf of ma'am, we have one question, ma'am.
What question?
It's from Rohini, ma'am.
OC pills are usually effective only. If OC pills are not effective, then you have to consult your physician regarding the next step. It all depends because we have to see whether the person is a nullipara or whether she's already having a child. Many issues are there. That is why we have a comprehensive discussion with the person before we tell them to take a particular contraceptive measure. So it is individualized. There are hundred number of contraceptive options, but it is always individualized according to the needs of the person and based on how many children they are having, or they do not have any child at all, based on that.
Yes, ma'am. Thank you, ma'am.
It is not English medicine, it is always evidence based medicine. So that concept we must know because many herbal medications, everything they tell, no side effect at all, like that. No, that's not true. What we have is evidence based medicine. We know what we are going to give and what side effect you might be experiencing, everything. But in herbal medications, there is a scientific research paper itself available. They lead to severe end organ damage, renal failure, kidney issues are so common, heart issues are so common with herbal medicines. So we know that with all these developing technologies, there are no more herbs available in our countryside anyway. So we must always say it's evidence-based medicine.
Okay. So now let us move on to vote of thanks. I, Shweta E, from third year Biomedical Engineering, on behalf of Chennai Institute of Technology, I would like to extend a very hearty vote of thanks to our chief guest, Dr.S.KARTHIKAA ma'am, and our principal, Dr. Ramesh sir, for gracing your important work and sharing with us your findings and guidings. So last but not the least, I would like to thank all our staff members, our professors, and my fellow engineers. Thank you all. Let us conclude with national anthem.
पंजाब सिंध गुजरात मराठा Ma'am, thank you very much, ma'am.
Thank you, ma'am.
Thank you.
Yeah,
Yes, we can.
Shweta, you can.
Okay, ma'am.